just starting with what is epidemiology. A lot of you may know this, the study of the distribution and determinants of health and disease and population. Epidemiology has changed quite a bit from its traditional way of just thinking about risk factor analysis, and we're very systems-based, much more systems-based than we have been in the past, much more in our department driven by biological sampling and understanding questions that are much broader in the context of things like climate change and big data than we have in the past. But it remains a data-driven scientific process where we're really trying to understand patterns of diseases and why we see those patterns of diseases, and we want to, look for modifiable risks that we can intervene upon, since it's inherently a public health discipline. And so epidemiologists in general look at a wide range of determinants, and I'll be repeating this over and over again, but since we're such a big department, a big school, and a big university, public health is not just happening in our department, and epidemiology is not just happening in our department, but also happening in the university, specifically in our professional schools like the School of Medicine. And so you can find examples of these determinants: genetics, health behaviors, social status, public policy, environmental ecology, and more in wide range of research is occurring, within our department and again, more broadly. We're looking at various outcomes. Traditionally, we've always divided outcomes into infectious and chronic, but more and more, a lot of us are looking at some of the infectious causes of chronic diseases and the sort of interaction between chronic and infectious diseases. Aging behavior and looking at behaviors and looking at social determinants of some of these outcomes is pretty central to epidemiology in our department specifically. We've looked at, again, we often think about domestic versus global health, and we've got many of our faculty doing both domestic and doing global health, some doing more basic research and some doing more applied practice research, and some kind of straddling between those. And the tools that we're using in epidemiology range from observational studies to more experimental randomized controlled trials, laboratory methods, systems modeling, and surveillance. So I want to emphasize that we're a unique department in that we do have laboratories in the Department of Epidemiology. So a lot of people are working in that capacity in the laboratory. A lot of it doing diagnostics of different organisms or biomarkers and such. And we're also unique in the fact that we do a lot of systems modeling in our department, and we have a lot of faculty, and I'll mention that later in the context of one of our tracks, MS tracks. So next slide. So we've got, epidemiology is inherently interdisciplinary and crosses lots of different disciplines. And here just shows you the wide range of disciplines that epidemiology works in. And again, because we have such a large department in school, and because we are so close and connected to our Michigan Medicine and the School of Medicine, where it's actually literally walking distance to our building, we've got a lot of clinical epidemiology happening, both with us and often in collaboration with people in the School of Medicine. We've got growing interest in disease ecology, as I mentioned before, math and statistics. We've got a big program in computational epidemiology and systems modeling. Again, I mentioned bacteriology and virology. We have labs in our school, in our department, and a lot of people working in those areas in the context of population health. A wide range of social science fields. We have a very strong social epidemiology program that works in a lot of these areas, looking at disparities, disease and health disparities, and a lot of people doing some more, again, basic biology work, thinking about nutrition and immunology and genetics. And we have a growing interest in practice. We have faculty members that are clinical faculty members that are doing work in health departments, and we have a lot of collaboration with both local and state health departments. Next slide. So why study epidemiology at Michigan? One of the aspects that we're most proud of is that we really focus our master's training on theory, methods, and application. So we train our students to understand methods and understand the statistics needed to analyze data, and the modeling kinds of activities, and students get a very deep understanding of that. At the same time, we're working with, again, as I mentioned, with health departments, both regional and local, so that students can apply that, and also the internships that you do between your first and second year gives you an opportunity to apply what you've learned the first year in practice. We focus on, as I mentioned, analytic skills, but also communication, presentation, and writing skills through how to develop posters and how to give talks and presentations, and encourage that. We have funding to send students who are presenting in conferences. We have funding to pay for their conference and travel expenses. And as I mentioned, we have our internship placements, which we've got lots of connections locally, regionally, and globally that allow us to place all the students in, depending on their interest, in a summer internship that allow them, again, to take advantage of what they've learned their first year and apply it into a real public health setting. And lots of opportunities, again, to engage in lab, field, and statistical research. And I want to really emphasize the fact that our faculty, and we hear this from students quite a bit, are very open to engaging with our students at different levels, both advising, career advising, as well as research. So this gives just a sense of where our students get involved in, because we have a number of different tracks as well that we'll talk about next, as well as a MS program. Core classes are about 100 students. Elective courses are range from 10 to 40 students. And again, we have different types of formats: lecture, labs, seminars, and public health practice. That's something that students are very interested in. We have a program where you can learn how to do rapid response, and then actually get placed during our spring break into different areas that actually need that rapid response. So we've got a number of tracks that I think come in. We'll talk about a little bit more in the next slide. No, job opportunities, next slide. So lots of job opportunities. I mean, this is a pretty standard slide talking about the wide range of government, both local, federal, and international, realizing that we are in a somewhat of a crisis in public health at the federal and international level, but things are improving every day now, and the local and state health departments are still strong in doing their activities. So government is one area in which our epidemiology students get placed, but also in nonprofits like the American Heart Association, American Cancer Society. Private sector is a big area, and then academia, both as research staff. A lot of our MPH students stay on with us or other universities and become research staff, and others decide to go on to doctoral training, getting a PhD. Next slide. So here's where we have. So we have our different tracks, which you're going to learn about now from our different track leaders, different faculty members that are in these tracks. We have general epidemiology, which is a broader track, bit more flexibility with respect to what you can do, and really allows you to focus on methods and analytic courses. But if you're interested in some of these other areas, there's a great opportunity to study, to be in the global health epidemiology program, which you'll hear more about, hospital and molecular epidemiology, occupational and environmental epidemiology. And then we have another program, an MS program. So the first 4 tracks are MPH programs. We have an MS program, which I'll talk about a little later, on computational epidemiology and systems modeling, as well as a PhD program. So I think we are now moving to to talk about the tracks, and the first track we'll talk about is in global health with Marie O'Neill, who's our track leader for global health.
Hi, Joe. Change of plans. Marie is going to be a couple of minutes late, so we're going to jump directly to general epidemiology.
Okay.
Okay, so welcome everyone. My name is Andrew Brower, and I am one of the track leads for general epidemiology. Christine, I think we need to go back a couple. Oh, perfect. Here we are. So I'm going to introduce you to our most flexible track, general epidemiology. So next slide, please. Okay, great. So what's exciting about the general epidemiology track is that we're providing really this kind of breadth of both skills and knowledge that is the foundation of the work that we do for robust public health. And so both investigation and discovery is fundamental to the work that we do as epidemiologists. And our goal for the general epidemiology track is to give you the flexibility to study the kinds of determinants and outcomes that you want to learn about. You're going to get a really strong methods training that will allow you to apply these methods as you encounter new problems, but with the right tool set. And we want to be able to focus on public health practice and communication and turning the insights that you're generating by applying these methods to your areas of interest into action. So next slide, please. And so when you're in general epidemiology, you're going to learn things like both large and small scale study design, methods for both effective but also ethical data collection, statistical analysis of complex data sets. That's actually with me. So you'll take Epi Methods 2 in the winter semester, and this actually goes for all the tracks. And so we're going to work to learn together regression modeling for complex data sets. But you're also going to build a broad knowledge of epidemiological literature through your elective choices. And throughout the program, you're going to be developing effective communication of findings and of recommendations. And that will also be part of your, not capstone, but integrated learning opportunity IPSI course. And finally, translating empirical findings into practice and policy. Next slide, please. So we have a number of competencies, and so these are the things that as you leave our program, we tell the world that you're going to be able to do things like describe population patterns of health-related risk factors, health-related outcomes in terms of things like people, place, and time. You're going to be able to compare the relative strengths and weaknesses of common epidemiological study designs. So when the government is making pronouncements about health things, you'll be able to say, that doesn't really make sense, and here's why. You're going to be able to interpret the impact and bias and effect modification on causal inference in epidemiological research. This is epidemiology is a quantitative methods heavy discipline, where we want to think very critically about how we are approaching our statistical analysis from the perspective of causation, and in particularly causation from a health perspective. We're going to be applying core aspects of Field's methods in epidemiology. That includes things like human subjects protections, survey design, sampling and power, surveillance. We have a very strong Institute for Survey Research housed at the University of Michigan, and many of our students take advantage of both research but also training opportunities through that partnership. You'll also be able to critically evaluate epidemiological findings from published research studies. Next slide, thank you. And so I said this is our most flexible track. That's true. So what are our students interested in? So this is going to be things like chronic disease, social determinants of health, infectious disease, reproductive health, climate change, environmental occupational exposures, aging, mental health, nutrition, microbiome, mathematical modeling, and global health. And many of these things you'll see in some of the other tracks. So why pick general epidemiology versus one of the other tracks? Well, in general epidemiology, you have flexibility and the power to kind of decide to follow the things that interest you. And so we have a lot of space to take electives that will help kind of guide the program that you're interested in. Next slide. I really recommend that you take a couple of minutes to check out the diverse faculty expertise. Here's a link on our website, and you can kind of drill down in each of these areas. So like chronic disease, we have experts in everything from aging, cancer, health disparities, women's health specifically. And you can see which faculty have expressed interest or expertise in each of these areas. Next slide. Something that I recommend students think about, particularly in the general epidemiology track, is about our certificate programs, which are available both in the School of Public Health, but also across the university in partnership with schools like public policy, sustainability, architecture, and thinking about how you can focus your kind of elective time to develop expertise that you're interested in. And so although these are links, I'm not sure that whether these are being sent out after. They are available as links on our website. Next slide, please. And so I've mostly talked about kind of the course side of things, but there are also a lot of opportunities for GE students outside of the classroom. So this includes things like flexibility in your internship options. So all students will have to do an internship. This can be anywhere from local to international. You can participate in both academic and non-academic activities at U of M. One thing that is great about U of M is that there's like so much stuff you couldn't possibly do it all. It can be a little bit overwhelming at times, but it always means that there's something to learn and something to get involved in. Some of our students get involved in research with our faculty and staff, or even engaged with public health partners directly. Next slide. Okay, so that's it for me, and I'll pass it off to Jennifer, I think.
Hi, thanks, Andrew. Can everyone hear me?
Yes.
Okay, awesome. So I am the track lead for hospital and molecular epidemiology. And I apologize, I just joined this webinar because I was coming from teaching class. So I apologize if I have said something that others have already said. But we have a lot of faculty who focus on hospital and molecular epidemiology, which you can see here on this slide. Next slide. So hospital and molecular epidemiology is a really unique track because it has a special focus on laboratory work that focuses on building skills in molecular epidemiology and preparing students for careers in a hospital setting or other clinical laboratory settings. So we do cover in our curriculum the same types of courses and competencies that you will find in the general epidemiology track that Dr. Brower has just presented. So you will be taking courses in biostatistics, study design, data analysis, and R programming, as well as other programming languages if you wish. But then it adds on special courses specific to the HME track. Next slide. So some of these courses have a stronger laboratory focus. In general, there's different tracks and different like competencies that you will add in addition to the general epi curriculum. So you'll take required courses in infectious disease and pathogenesis. You'll take a course that is very popular in laboratory techniques and how to analyze laboratory data. And then there will be electives that count towards your HME credits, including in courses that focus on topics like genetics, bioinformatics, healthcare epidemiology, things like that. So on the right-hand side, you're seeing a photo of some HME track members in that laboratory class where they are doing some really cool hands-on lab projects as part of their curriculum. Next slide. So there are a lot of opportunities for mentored experiences in research for students in the HME track because you are focusing on molecular epidemiology. A lot of students do get involved in more wet lab work, and so you can see many students here engaged in things like that. There is a very neat certificate called the CHIP certificate, which is focused on infection control and prevention that places students in a hospital setting where they can gain practical experience in infection prevention. And so many students will choose to take advantage of that opportunity and apply for that internship experience. HME students have also been involved in kind of molecular and epidemiology experiences outside the laboratory setting. You can see some fieldwork photos in the bottom right, doing environmental sampling and also doing community sampling for different pathogens as well. Next slide. So our students work in a wide variety of places following graduation. As I mentioned, many students will choose to do what's called the CHIP certificate, which focuses on infection control and prevention. And there is an infection or a CHIP internship that students may also apply for. And so students, especially who are interested in infection control and prevention, often are interested in and highly suitable candidates for hiring within the hospital setting where they can work as infection preventionists or data analysts. They can also go to health departments or CDC, where their training makes them especially skilled in outbreak investigation, understanding how surveillance systems function and work, and emergency preparedness. And then, of course, industry and academia are also settings where HME students find themselves in. Next slide.
Hi, good afternoon. I am here to tell you about the Global Health Epidemiology track. Next slide, please. So this is one of our very popular tracks for students interested in global health, and we have two courses in your first year that help you get briefed on what is global health, what is global health epidemiology. One is a broad introduction and another is field methods. Then we also have track-specific sections of the courses that are common to all of our MPH epidemiology students listed here. And then we also have required area studies courses in order to give you some expertise in the area of the world you're most interested in. And then there are also electives you can take around global health policy and global environmental health. Next slide, please. So the idea of the internship, which all of our global health epidemiology students have to do, is to apply some of the principles and tools that you have learned to actual practice of epidemiology in another country. And this is typically a lower middle income country, indigenous communities, or in communities where migrants from low and middle income countries live. And the settings for such internships include public health agencies, healthcare delivery organizations, or research settings. And there can be a range of activities that our students do depending on their site placement, research proposal development, data collection and analyses, and helping to write reports or manuscripts, and participating in laboratory science. And all global internships are eligible for funding from a range of sources across campus. Next slide, please. So here are just a few of the examples of the kinds of student projects and internships we have had. And you can see a whole range of countries in the world where folks have been placed. And some of them have been local, working with Arab immigrants or even farm workers who are migrants in the state of Michigan. Next slide, please. And you can see here that we have a whole range of faculty who work in global health. You have already heard from Joe Eisenberg, and some of the interest areas are listed below these individuals' pictures and the countries that they have research in. Next slide, please. We also have global health epidemiology faculty who work in the area of social, environmental, and occupational epidemiology. Alexis Handel and I are both the teachers of the 2 introductory global health courses. Next slide. And then we also have faculty who work in cancer research and capacity building. Notably, Ella August is a leader in this area of building capacity among researchers from low and middle income countries. Next slide. So I'm also going to plunge right into one of our other tracks, which is the Occupational and Environmental Epidemiology, or OEE track. And this is a picture from one of our picnics a few years ago. This includes both MPH and PhD students in the track. Next slide, please. So you can see depicted here that we have quite a number of faculty who do work in this area, including Jennifer Head, who just gave an overview of the Hospital and Molecular Epidemiology program. So these are all faculty who are available to work with and mentor students who choose the OEE track. Some of them are from other departments, for example, Environmental Health Sciences, where I am jointly appointed. Next slide, please. And people who choose the Occupational and Environmental Epidemiology track might be interested in environmental exposures that may occur outdoors or through food we eat, occupational exposures for workers. We study the health effects of these exposures, and we look at these exposures from a whole range of life stages, from prenatal to infancy, childhood to older adults. Next slide, please. And the OEE coursework is the basic general epidemiology courses plus courses that provide expertise in environmental and occupational health sciences course. So those include exposure science, toxicology, occupational disease, and then one of the important courses is environmental and occupational epidemiology. Next slide, please. So students in this track can participate in a range of seminar series, We have tuition through a training grant from the National Institute for Occupational Safety and Health. And then we also have a range of social and networking events with our alumni. Next slide, please. And these are just some of our folks with their posters. We have some highlights of things that our graduates have participated in during their time. Zia, Jackie Cardosa, and others. So it's a very, really opens up some opportunities for you if you choose this track. And then you can see one of the important features of this track is we have a lot of fun, and sometimes students studying occupational and environmental epi get to go to conferences and participate in research exchange there. So I'm happy to entertain any questions about this track. My email is listed there, so thank you very much.
Thanks, Marie. So that gives an overview of all the tracks for our MPH program. And I wanted to talk a little bit about our MS, one of our MS programs in computational epidemiology and systems modeling. It's an MS degree, and it was designed a bit more to cater to people that are more interested in research, potentially going on to a PhD, but also we've had many students from this program come from a health department and go back to health department, because health departments are more and more interested in this kind of level of analytical approach to modeling, as we saw during COVID, for instance, and the use of epidemic models to help think about guidelines and policies. So this is just a list of our faculty in the CSM program. As I mentioned, we have a very strong group of faculty that either focus primarily or focus as part of their research systems modeling questions. Next slide. So this is a 42 credit MS program run through our Rackham Graduate School. And the idea here is that you're actually taking all the same epidemiology courses that the core courses that the students are taking in the MPH program, but we're also taking more computing courses and more math statistics courses, all helping you with our core modeling courses that we offer in our department, sorry. And so again, the core elements of this program is to really train you at a next level up with respect to quantitative analysis, statistics, and computing, as well as mathematical modeling. You'll take a lot of elective courses in modeling, and here are some examples of kinds of modeling questions. To the left is modeling of our COVID pandemic, and we were, as many faculty, were actively working with both the governor's office as well as the state health department in modeling the epidemic as we were going through the epidemic. A lot of modeling in the upper right-hand corner, looking at connecting wastewater surveillance of pathogens and using our epidemic models to translate that into epidemiologic epidemic curves. And looking at another example of modeling hepatitis A transmission in Michigan, we had a big outbreak, as well as many other states in the country in 2016-17, and we were able to help and work closely with the Department of Health in helping think about how to mitigate that outbreak. And then in addition to the infectious disease applications, which is very strong in the systems modeling area in general, we also have a lot of work in chronic disease modeling and behavior modeling. Behavior modeling, we have a big tobacco center looking at smoking and smoking behaviors, as well as looking at lung cancer screening. We have a number of centers that I mentioned before. Not only are we a strong department and school, but we have very strong university that houses a lot of centers. The first center, MECOM, is one that is connected to the Department of State level, Michigan Department of Health, on outbreak analytics. As I mentioned before, we have this tobacco modeling center. And then we've got this computational discovery and engineering, and we have Center for Studies of Complex Systems, as well as, which are two big university level centers doing that a lot of students get involved in various levels, from seminars to courses to certificates. You can get a certificate in complex systems, for instance. CISNET, the last one, is another big modeling network that is housed in our department. Where do students work? Much the same places that I already mentioned in the previous slide, talking about in the MPH program. Again, this is designed for people interested in research, specifically wanting to get a PhD. A lot of people, this is a valuable degree if you wanted to move into doing analytic work in industry or health departments. So moving on to how to apply. First, for the MPH. So the MPH degree is housed in our School of Public Health, and the application is submitted through SOFIS. You can go to our School of Public Health website as shown here, and you can just click on Start Your Application, and that will start your process in SOFIS. And then for the MS program, that's administered at the university level in our Rackham Graduate School. So you apply through Rackham for this program, and the URL is here on this slide for those interested. Again, this is a more quantitative program than our MPH program. Even though epidemiology in general, it is quantitative, but a little bit more intense and focused on that quantitative piece. So your background, this quantitative background, becomes more important in the application process. So requirements and deadlines. So basically, there's an application, statement of purpose, transcripts. You need 3 letters of recommendation. Main thing to focus on here is the December 1st priority application deadline. That's going to give that priority is with respect to funding specifically. So those are students that are applicants that get their application in by December 1st will be considered in this priority area. We still may have money left over for those that don't make the December 1st deadline, but it's advantageous to get your application in early prior to December 1st. For international applicants, we have a January 15th final deadline, and then for you all, there's an April 15th decision deadline to make your decision with respect to which school you want to go to. So what makes a strong applicant? As I mentioned before, epidemiology in general, both in the MPH and more true in the MS, it's grounded in quantitative methodology, and therefore it's recommended that you have courses in math courses, specifically algebra, calculus, statistics. The calculus becomes, the more calculus you have, the more opportunity you have to take some more of the advanced biostatistics courses. In addition to being grounded in quantitative area, it's also epidemiology is grounded in biology. So having courses in biology and chemistry, organic chemistry, is also valuable. A statement of purpose. I think I will always emphasize to be specific. in your statement of purpose, the more specific you are about your interests, about your passions, the stronger that statement of purpose is. And so you want to, and think about why, not just why you're interested in epidemiology specifically, but why you're interested in Michigan. Take a chance, take the opportunity to look at our faculty profile online, see the kinds of work that we're all doing, and that will help provide information so you can have a more specific statement of purpose. Work and practical experiences are very important, is important in getting us having a strong application. Not everyone has extensive practical experiences, but whatever you have, you want to include in your application. And of course, letters of recommendation, always better to have people that know you better, that you've worked with, to write those letters to, again, when those letters are more specific, they're stronger letters in general. And we also have this quantitative experience statement because we realize that people have, beyond the coursework, people have experience on the job and in different contexts. It also gives you a chance to just highlight where you've gotten your quantitative skill set and background that we might miss by just looking at your transcripts. Funding. So we've got departmental tuition scholarships. We usually 40% of our applicants receive tuition scholarships. They can be anywhere from half, 3/4 to full tuition scholarships. We also have research awards. So we give people research awards that provides opportunity to work 10 hours a week throughout each term of your while you're a student here with a faculty member. And so anybody who gets one of these research awards, we actually, the recruitment committee helps pair you and match you with a faculty member, so you're able to conduct research at 10 hours a week. We do have gift scholarships. Highlighted here is those with dental and nursing backgrounds, because a lot of the scholarships are targeted, and we happen to have some targeted toward dental and nursing. And then internship funding. We support internship funding both domestically and international. For the international students, we have funding for your transportation and living expenses during your internship in whatever country you're going to be in. And then there are some internships that are fully funded, and then you're pretty much set. Those that are underfunded or not funded, we do have some funding at the department level to help provide you with resources for those domestic internships. And then additional financial support outside of our department. The work study funding is through federal loans or federal assistance. And then there's also graduate student instructor positions, which are very nice positions. They pay for your tuition and stipend. We have some in our department. We do prioritize PhD students, but we can often have students with GSI ships within our department. But also the advantage of being seated in a big university is that there are departments, and if you have a biology background or chemistry background, often they are competitive, but often our students can get these positions within some of the undergraduate programs in LSA. There's also graduate student research assistant positions, which are, I would say, rare in our department because the priority goes to PhD students. Though what's not rare is that we do lots of research activities. Research programs do fund master's students at an hourly rate to do work in studies. And also just keep in mind that there are other schools like the medical school or other professional schools that also hire students to work on their research projects. So now I will hand it over to Nancy Francis to talk about student service team.
Hi, everyone. I'm Nancy Francis. I'm the admissions coordinator, and we have a strong student services team at the epidemiology department here. From the time that you apply till the time that you're here, we're here to support you. So if you have any questions about the admissions process, you can reach out to myself or Christine Cole at epidadmissions@umich.edu. And then besides the student services team here in the epidemiology department, there's a lot of support for students when they come here. We have an Office of Student Affairs, and they're the first person who receives your application once you apply. And then once they process it, it will come up to the department here. We have a student funding guide that's on our website. That's a really good reference if you have funding questions. There's also health and well-being. We have a lot of support for that. We have mental health, resource and success coaching. We have sports and recreation. We have a new recreation building that is being built and should be completed soon. We also have classes that students can attend, so like yoga. There's also an alumni engagement, an Office of Global Health. There's Public Health Action Support Team, and we have tutoring that we offer as well. In the Public Health Careers Office, they offer a lot of support for like internships and jobs and career preparation workshops. And then we also have like counseling and services for our students. And then there's a lot of student organizations here at the university. We have an amazing epidemiology student organization, and they provide a lot of support. And I'm actually going to turn it over to Marina now to tell you a little bit more about the student organization.
Hi, everyone. Thank you, Nancy. So Epidemiology Student Organization has lots of leadership positions which are here. So I serve as social chair. And then we have the president, secretary, academic chair, treasurer, professional development chair, and organizational culture and belonging chair. And then non-pictured here are first year representatives, which is an opportunity for first years to get involved in sort of like a mentorship program with the current executive board to then just connect on professionally with career goals and or within the organization if first year representatives are interested in taking on the leadership role in their following year. Next slide, thank you. So just a little bit overview of what ESO is. The purpose of ESO is to represent student voices on department committees, offer leadership opportunities to both first and second year students, strengthen professional development, and host social events to build community in the department and promote well-being amongst all of our busy schedules. So some of our examples of social events that we've had this semester, we had an Ann Arbor scavenger hunt, we have a cider mill trip this Saturday, we've had trivia nights, movie nights, bar crawls, group study hours, and service events. And so now we're going to transition into hearing from current students about why we chose Michigan. I will begin since I'm already here. So I am in the general epidemiology track, and that is pretty much one of the biggest reasons why I chose Michigan was the flexibility that the track offers. You have your core curriculum, and then you have the ability to explore a lot of your interests. And for me, that was really huge because I have a lot of interests and wasn't particularly interested in picking a program that kind of boxed me into a specific track per se. So through electives and certificate programs, it's been really awesome to explore all sorts of the different courses that the school offers. Also, the classes really focus on skill building, transferable skills so that you are competitive in the job field. And overall, SPH as a whole just has a lot of opportunities and student resources. And within that, there's a lot of opportunity for individualistic attention for any of the needs that you may have, like Nancy described, through the different services that are offered, but also with faculty, which was super important because it is a big school, but the School of Public Health does feel like a small school, and you do have very great relationships with faculty for help or for career advice. Yeah, thank you.
I think I'm next on the list. Can everyone hear me, by the way?
Yes.
Okay. My name is Raksha. I'm a global health epidemiology student, so that track is a little bit smaller, but the difference is that we take some classes geared towards global health, then we also do an internship centered around a lower middle income country or population. So those are the differences between general and global health. And to share a little bit about why I chose Michigan, I want to echo Marina in that one thing that really drew me to the school is the flexibility to customize the experience that I have here. And what that means is you're able to take classes outside of SPH if you want to. Like we have a great engineering school, we have a great business school. So I've taken advantage of all of that and taken classes at all these different places and really customized my experience. And the other thing that really drew me here is the opportunity to explore my career interests and really hone in on a specific career path and get a lot of support there. Like I've been able to engage in research, did an internship abroad that was funded by that internship funding that Dr. Eisenberg was talking about. And, I'm able to do practice-based opportunities with FAST, which was mentioned earlier in the slide. So there are just so many opportunities to do what you want to do. And whatever you're interested in, there is a way to pursue that here, which I really love. And there's also just a ton of student organizations for affinity groups and passions of yours. So it really is a great place to learn and grow, and the career support is unparalleled as well.
Hi, I'm Allie. I'm another student ambassador for this, and I'm a second year in hospital molecular epidemiology or HME. And one of the reasons I chose Michigan was I have a background in pharmaceutical sciences, and I've always been intrigued by infectious diseases, and it was actually a microbiology class that set me into epidemiology. And so the HME track specifically having that clinical microbiology aspect to it was something that ultimately drew me to the program and had me pick it out. I also was lucky enough to I'm pursuing a CHIP certificate, and so that's a certificate in hospital infection prevention, and I was a CHIP intern this summer at Michigan Medicine, and I really felt that my classes prepared me to be a successful intern and contribute to the IPE, the Infection Prevention Epidemiology Department at Michigan Medicine. And overall, it was just fantastic, the connections I was able to make through both the program and through being a CHIP intern.
Hi, everyone. My name is Olivia. I am a second year student in the Computational Epidemiology and Systems Modeling master's program. The reason I chose Michigan is because I have a background in mathematics. My undergrad degree is in math, and I really wanted to apply math to something where I felt like I was helping with health-related matters. So that's why I chose the program. And I'm kind of echoing the thing others have said about flexibility within the programs. I've also found there's a decent amount of flexibility in the CESM program. For instance, I'm doing a certificate in complex systems because I really liked kind of the mathematical modeling side of things. I also do research, mathematical modeling research in tobacco control with Dr. Brower. And I really, really enjoy the program. There's a little bit of like math theory involved, but you also apply it a lot, and the mathematical modeling is quite a lot of fun.